I'm Adrienne Fu Berman, and I'm principal investigator of PharmedOut, which is a project of the Georgetown University Department of Physiology and Biophysics. It's a program that's funded by the Attorney General Prescriber and Consumer Grant Program, and the money comes from a settlement made in 2004 with Warner Lambert, which is a subsidiary of Pfizer, for illegal promotion of a drug called Neurontin. We have a website that provides links to more than 200 continuing medical education credits. We have a lot of different plans for the project, but part of what we're doing is a series of videos illustrating both different techniques that pharmaceutical companies use to influence physicians and also to influence medical information. We're talking to various insiders within the industry. There are conditions that are basically invented that are really normal variations on human experience. There's a drug for overactive bladder syndrome, and there are commercials, for example, for this class of drugs that make it seem like it's really abnormal to have to urinate every couple of hours. Drugs can do some really great things. And there are life-saving drugs, and there are drugs that are really effective for some chronic medical conditions. But drugs also have side effects. They also have adverse effects. Most drugs are approved with a limited amount of clinical trial data. And when you're doing a clinical trial, you always choose the healthiest population possible to test your drug in. Obviously, if you're testing a cancer drug, you have to test it in cancer patients. But even then, you choose the healthiest cancer population that you possibly can in order to test your drug. And you try and make sure that they're not taking a lot of other drugs, for example. Then once a drug is on the market, even if it's used for the purpose for which it was approved, you're using it in older people, younger people, different ethnic groups. The FDA can require that post-marketing trials be done by a company if they have some concerns about a drug, but they have no enforcement capability. So most phase 4 studies, as they're called, are post-marketing trials, which are trials of a drug after it's on the market, have never been completed, and there are no sanctions against companies for not completing those studies. Right now, because of PDUFA, which is the Prescription Drug User Fee Act, pharmaceutical companies actually contribute money to the evaluation of their new drugs at the Food and Drug Administration. The U.S. is a wealthy country. We should be able to afford to evaluate drugs in an independent fashion. Right now, if people report adverse events to a pharmaceutical manufacturer, they do have to report those to the FDA. The FDA does not have the authority to actually punish companies that don't do the sorts of studies after marketing that are necessary. Physicians probably aren't aware of how drugs are regulated in the United States, and just to give an example of that, generic drugs have to have the exact same chemical constituent in the same dose and in a similar formulation as branded drugs. They are just as good. I heard a story the other day about a physician being told by a pharmaceutical company representative that, oh, you should never use those generic drugs. Did you know that generic drugs can actually have 20% more or less of the active ingredient in them? Now that's a perfectly true statement. Generic drugs can have 20% more or less of the active ingredient in them, just like the branded drugs. That's the range of potency that's required by the Food and Drug Administration for all drugs.